This is the May 5th meeting of the Porter County Board of Health. President Moore. President Moore, you can take over the meeting now. President Moore, can you hear?
Hi, Gal.
Could have his
Hello. Listen, can I call you right back? Can I give you a call right back? Okay, I will. Bye-bye.
Amy, Dale Fluthoff, line 2.
President Moore, can you hear us now?
somebody there. I think he has his
Somebody
audio
needs to
off.
text him.
Yeah, somebody needs to text him.
Dave, can you text him?
I'm gonna call him.
Okay.
Yeah, he doesn't have his audio because there's a computer and the audio, separate things. Because we do Zoom at home with the kids.
Do you?
Yeah.
We're having technical difficulties. If you please stay tuned.
Our family's project last weekend was to learn how to pull up audio visual and show it to the rest of the family. If you'd like, I've got some pictures.
President Mueller, can you hear us now?
Kurt, you had some indication that he was in.
He is in.
Yeah, I see him. He's on the screen. Maybe just write on a piece of paper.
I sent him a message.
Hello, this is Martin.
Martin,
Martin?
Do I not have my sound on here? Is that the problem?
Yes, that's it.
That's,
I thought
Hello,
it was
Dave.
just me.
yes, you got the sound on. I think we can hear you now.
Well, I'm on the phone. I don't know that I'm coming across on the medium here. Okay, I'll get back on my. Am I
Can
coming
you-
across on the Zoom or not?
Yes, we have you. You can go ahead and start the meeting now with the Pledge of Allegiance.
Okay, I'll hang up with Dave here. Okay, so we have reached the 5:30 hour. It looks like we have 13 participants on the Zoom here. So I've seen a couple of our other board members. I'm assuming that we do have a quorum. I believe we're going to check in each person. Well, let me call on them based on our last attendance, and we'll see who is with us. Dr. Stamp, are you with us?
I am here.
I see Dr. Stamp's face, but her lips aren't moving.
I am here.
And of course, Dave just called me. I see Donna Warner's face, and I'm looking at
Yes.
her name on our roster.
No, what's that?
And I'm going to need to get somebody to get me some sound on on mine. I see Donna speaking, but I'm not hearing Donna either. So hi,
Oh, okay.
hello there, Donna. Let me see if I can get some sound going so we're up to speed where we need to be. Just a moment. Okay, I need to let one of my technological enablers try to get this ready for me here. So this is Melissa.
Hey, Dave, can you
Yeah.
text Martin to maybe look for the button to enable internet audio?
That's muted right there.
Can he hear us? He just, oh, you like, okay, yeah, you're right.
Okay, well, she doesn't need to, so. Yep. Hello, Dave.
You still having trouble hearing us?
Yeah, I've got Melissa trying. Yes, I wasn't getting any sound from you, but you were hearing me.
Yes, we can hear you.
Okay, so yeah, Melissa's working because I got Jamie got me hooked up, and now she's off the other line. I could have Jamie come down. She's the one that got me set up.
Could it be as simple as you've got your mute button on? Mute.
There. I don't know. Are we getting any sound through now? No,
Yeah,
my
we've been
voice
able
isn't coming
We can
through.
hear you. You just can't hear us.
Yeah, let me see if I can get Jamie.
Dave, would you ask him to log out and log back in?
Okay.
Actually, Dave,
Yeah.
if
Hold on.
you tell him to just tap on the screen
Hey, I can
and
hear you guys.
press, okay. Yeah, you just had to find the audio button.
All right. Here
Well,
we
thank you, tech expert.
It took me too long. I'll go grab Martin.
What did he do? Walk away?
Want to grab a sandwich.
Glass of wine. It's Cinco de Mayo. I think he went for a margarita.
Is
Oh,
that
that's
tacky to
good.
drink wine during this meeting?
I thought about it.
A reminder, we are still live on Facebook.
Oh.
Oh, I'm sorry.
No need to be sorry, Donna. It was everyone else was ready but me.
That's okay.
Okay, so I had stopped with, we've got Donna present. Is Elizabeth present?
I'm here.
Okay, Elizabeth is there. I see Suzanne's face.
Yes, I am here.
Thank you, Suzanne. And Kathy Lemon I see on the line.
I'm here.
Thank you, Kathy. And Dr. Fleming.
Present.
Thank you, Dr. Fleming. Dr. Gasper.
I'm here also.
Okay, thank you, Dr. Gasper. And Letty. I think she was I thought I saw Letty on there in the office.
I'm here.
Okay, Letty and all the nursing staff in the one room, and Chris and okay. So we have our flag up. Suzanne, I didn't get to you today because we were having a small crisis in my office today, which is why we weren't ready to go here. As far as the Pledge of Allegiance, this is the one thing we're going to have one person say the pledge. Is that something you think you'd be comfortable with, Suzanne? No.
Sure, I can say the pledge. Sure.
Instead of having everyone talk at one time. So we will begin our meeting by Suzanne leading us in the Pledge of Allegiance.
Oh gosh, Marty, you're killing me. All right. Do I have to stand? I should stand up. Yes.
No, I think you get special dispensation for this.
Thank you. All right. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you so much, Suzanne. You were under the gun on that one.
No kidding. All right. Now I'm muting my microphone.
Okay. We have the minutes were all presented. Chris had quite a package of reports and things to you, but we will entertain a motion to accept the minutes from our April meeting. If one of you would place that motion.
I'll move.
Motion to approve the minutes.
Okay, we have a motion by Dr. Gasper, and do we have a second by Donna Warner?
Yeah.
Donna
I
would like.
second it.
Okay, thank you. All in favor, please designate by saying aye.
Aye.
All opposed? Motion carries, the minutes are approved. Letty, as far as our next meeting on June the 2nd, what can you tell us about possibly doing this via Zoom or face-to-face?
I can't possibly predict that. I can only make an assumption that we will probably not be on Zoom, but we'll find out as we get closer to that date.
Okay, so we will.
Martin, I can tell you that the governor's executive orders, one of which establishing the public health emergency, and it's that order that facilitates our ability to do this on Zoom, has been extended through June 4th.
Okay.
So the option of doing it will still be available for a June 2nd meeting. We don't have to do it that way, but it would be available to do it that way.
Okay, so I think we'll wait until a week before that meeting. We'll reach out to the participants and see what their comfort level is, if they want to do another Zoom meeting or face-to-face, if possible. We'll see what the circumstances in our county lead to by that time period in about 4 weeks. So, but
if we meet in person on June 2nd, do we need to find an alternative location? That's the delayed primary day, am I right?
Right. Yes.
That's a good point, Doctor. Yes, because they commandeer the whole building for those things.
Okay, so Zoom might be our best option on that date if we choose to meet, and I suspect that we will, just for an update on what's going on by that time. So let's just plan for a Zoom meeting, and if we need to change it to face-to-face, we'll make alternate arrangements of some sort. So looking at our agenda, we had no new business items scheduled on there, and I'll let Dave and Dr. Stamp tell me if that has changed, if there is any new business, or if we can begin discussing what's been happening in the county with the COVID situation.
Yeah, I don't have anything that I'd couch in terms of new business. I do have some thoughts when we get into the report of board attorney.
Okay, we'll save that for then. And I think we'll look to Dr. Stamp to begin. We're going to try to do things very similarly to the April meeting, wanting to ask the doctors and our active duty nurses their experience over this past month and their personal expectations for what they see in their crystal balls. So I'm going to start with Dr. Fleming, if I may, and have him tell us what's been going on in his life the last month.
I think I've been appreciating the ability to do the televisits. And I'm impressed with CMS allowing not only the insurance to bill the televisits, but as of last week, allowed to bill equivalently for phone visits. So you're still getting reimbursed for your work, which helps administrative costs from pushing people into the office that shouldn't be in the office. So it allows administrative decisions to be made based on the contagiousness of the disease. Again, not getting confused with when states start opening things up, the COVID virus, the last I checked, doesn't just discriminate. And so it's kind of nice to have that, especially as a household. It's still stressful because there are still concerned patients, and the amount of COVID patients we're seeing are ramping up. So far, I think my wife had a death, but so far our office has not. But I think the challenge of seeing then the serum tests for antibodies, and I get a lot of questions about that. And then the continued questions about, I don't want to wear my mask, or I don't want to work, things like that. But for the most part, I'd say it fits the general public. 80% of our patients have been wonderfully, I think, considerate to the quarantining. and social distancing, and therefore, for the most part, do well. It's usually those that are either wanting to work or that are pulled into work that are exposed and wind up getting it. A perfect example was, people say, are we being a little too aggressive with not allowing people to go out? But I had a wonderful 50-year-old father of four, works in Chicago as a supervisor. And unfortunately, 3 or 4 of his colleagues got it, and he got it, and we verified it on a Sunday. He felt like he just had a little bit of a flu bug cold, but unfortunately, he's got a 7-year-old with lymphoma going through weekly chemo, and it just changes the game. And had he worked from home and not gone to the office, he wouldn't have gotten it. Now his son so far after a week has been okay, but he was pulled into children's, and even though he was didn't have any symptoms, was started on treatment. So those are the extraneous scenarios. It's not just, well, what do we do? What are the opening? What are the social distancing laws? It's how to think through secondary and tertiary problems, both physically and psychologically, that enter into our own home, as well as to the 15 to 20 people I see or my wife sees a day, and trying to juggle all that and come home and keep your kids upright. And so I think it's doable, and every week you have a new stress. This week is worrying about how things are gonna, in my opinion, explode. And so that's sort of been my last month. Appreciative again of all the support and the reports and the updates that keep me up to date and educated to answer questions that I get all day long. And I'm thankful that for the most part, I appreciate that. I think 80% of my patients, all of us in the general public, have been really strict with quarantining and social distancing. And that's sort of a bright spot. Anything in specific else that you wanted to ask about?
Not that I can think about, and I was a bit remiss. I should have started with Dr. Stamp, so I'll ask Dr. Stamp if she'd like Dr. Gasper to share experiences before her, or let her go after Dr. Gasper.
Oh,
Oh,
unmute.
no.
She needs to unmute.
Why don't we follow up with Dr. Gasper and then I'll go.
Okay, so
Mine is understandably lengthy.
and I should have started with you, so my apologies, but we'll let Dr. Gasper jump in and tell us his experiences these past 4 weeks or so.
Yeah, and then Dr. Stamp can come with a better presentation than mine, I'm sure. I'm very proud of the health department. You guys are doing a great job. Everybody's being followed up with, quick to respond to phone calls. I've heard nothing but positive things from the community and the nursing homes, and also from Porter, so good job. I'm also pleased with our county. I mean, if you look at our numbers, we're up to 260 something. It's been a very slow, pretty linear climb. It really hasn't been exponential. So hopefully that means with all the opening that some people are still going to continue to heed social distancing and better hygiene, by covering your coughs and washing your hands. So I'm hopeful. I'm a little optimistic. I am still nervous about nursing homes and assisted living environments. I get a lot of calls about that because I have a lot of patients in those facilities, mostly from family. These poor people have been sequestered for 2 months now, seeing people from windows, and that's about it. So that's running pretty tough on them. My nursing home residents are all becoming more depressed and more anxious, and I don't have a good answer for them yet. And if I look at the way they're opening up the state facilities, nursing homes are the last thing. So it's a tough road for them and a tough road for the employees. They're struggling. From a
Derek,
yeah.
Derek, do you have patients at Miller's Manor?
No, I do not. I think we have some hospice patients there. So that's a whole nother challenge that I'm having to deal with too.
Yeah. Thank
Yeah,
you.
I think they had quite a few cases recently, if I'm not mistaken. Yeah, it's scary. It gets in those nursing homes, it goes like fire. From personally, we're struggling at home. I have a kid with asthma, a wife with asthma, so I'm always nervous about bringing it home. But thankfully, so far, my staff at the office has been very good at keeping really sick people out in the parking lot. I mean, we go out and do a flu swab on people so we don't contaminate our staff. We have a pregnant woman in our office, so we really try to keep as much of the telephone business open as we can. And it's nice to see CMS did adjust those RVUs. So overall, I think that I'm trying to be optimistic. I think our numbers in the county are great compared to everybody else's, and hopefully they stay that way.
Okay, thank you, Dr. Gasper. I'll come back to Dr. Stamp, who has what she's describing as a lengthy discussion that I'm looking forward to, and I hope the rest of you are also.
Well, thank you. Okay, so as you can imagine, the month of April pretty much was consumed at the health department by COVID-19. I'm going to give you some numbers for where we stand currently. If you've been looking at the dashboard on the county website, you'll have seen most of these, but just to give you a sense of where we came from, our first case in Porter County was March 23rd. A month ago at our last board meeting, we had 78 cases in Porter County. As of this morning, we had 285 cases. Our daily new case count has on average been anywhere between, on average been about 5 or 6. Today, our new daily case count was 18, and there's some explanation for that. Yesterday we had 2 deaths. One had been on a ventilator since the middle of April, so had been sick a really long time. And the other one was a nursing home patient who was elderly. We've had a total of 9 deaths in Porter County at this point. 3 deaths have been in long-term care facilities. Going back to our 18 new patients, 12 of them were in the nursing home. That's from yesterday. We have a total of 16 in the nursing home that you had mentioned earlier. We are also seeing at this point quite a few cases from the correctional facility in Westville, employees that work there. That's a fair proportion of our current caseload. We have 178 as of this morning recovered cases. So we take them off our list. And so we've been running, and this is about how it's been. We've been running about 100 active cases on any given day. And you're right, this has been a linear climb. It has not been exponential. I've been very thankful for that. And I'm certainly hoping that today is not a change with that outlier of 18 new cases today. So going back to what we have been, how we've been spending our time over the past month. As I mentioned, most of our cases are healthcare workers, prison or jail related, nursing homes, or close contacts of somebody who has been sick from one of those other categories. Happily, hospital utilization by COVID cases has been decreasing over the past 1 to 2 weeks within Porter County at Porter Regional. Porter Regional this week resumed elective procedures, which was encouraging. The Indiana State Department of Health, as you know, has a strike team that tests around the state, actually a number of strike teams. And the strike team was in Lake County doing drive-through testing for most of the month of April. They were in Merrillville and Gary, and this week are in East Chicago through today. They test symptomatic, high risk, and essential workers. They did take 4 days to test both PCR testing and antibody testing for the combined study that is being done through the State Department of Health and the Fairbanks School of Public Health in Indianapolis. They were at Valparaiso's Ivy Tech campus, and then they had a mobile unit that was throughout District 1. If you remember, District 1 is Lake County, Porter County, Newton, Jasper, and LaPorte counties. They spent about a day in each of those counties. And I believe they tested together, they tested about 500 randomly selected residents of District 1. That's to kind of help in surveillance, and they're going to be doing that monthly for the next couple of months so that they can track long term. It is not used for diagnosis. There is changing coming to testing. There is still testing available at Porter Regional Hospital with a doctor's order, or if you are seen in the emergency department or so sick you need to be admitted to the hospital. However, the State Department of Health is contracted with an outside company called OptumServe, and they are doing testing starting tomorrow in the site is in Valparaiso at the National Guard Armory off of Highway 30. That testing is for any symptomatic resident of Indiana, and registration is online. They accept insurance, but they do not require payment, and they do not turn people away due to either ability to pay or insurance status. And they run those labs, OptumServe does. We should be getting results just like we get results now from any other lab. Also changing in the next couple of weeks is contact tracing, which you probably also have heard. The state is going to a centralized contact tracing system where positive patients will be contacted by a text message. And if they don't respond within 4 hours, they will be given a phone call. And if then they don't respond, it'll be forwarded to the health department to find them and help with that contact tracing. The details of the contact tracing is not, they're not finalized yet, and they haven't been put out to us completely. So we still have a lot of questions as to how the communication between that centralized tracing organization and the health department will operate. So, and that won't start in Porter County. It's going to be phased in for a lot of those counties that are more heavily hit than Porter County. So we're not anticipating seeing contact tracing for Porter County residents until at least May 18th, and that's a moving target too. So, but we're going to keep doing our work and keep contact tracing and contacting our patients, and until have figured out that it's taken care of elsewhere. We are always going to be available to Porter County residents who have coronavirus. Jess has been a superstar over the past month. She is, as Connie said today, a whiz on the computer. She has learned those systems inside and out. She can backdoor her way into systems she probably isn't even supposed to be in, and get answers we need. So she has worked with Kurt to update the dashboard every day. She keeps a spreadsheet of our positive cases and their status, and she jumps up from her desk when somebody calls and runs out the door to go test people who need to be tested and can't get tested elsewhere. So she has really worked very, very well over the past month, and we're super thankful for her and proud of her. a PPE is another thing that's associated with this. So that's kind of the clinical side of things. Now we get to the logistical side of things. PPE procurement continues to be problematic. We have received PPE from the Strategic National Stockpile twice, and we have received PPE from the MAC, which is the District Coordination Center, and from donations. And we've distributed those as we've been able to first responders, long-term care facilities, and other clinics and nursing facilities. There are lots of people to thank for donated PPE. The United Way, the school districts, the Porter County Career Center, Ivy Tech, individuals. Becky Childress is the wife of someone who works in the county in the IT department. She's made masks for the department. The animal shelter, EMA, they've all donated PPE and really stepped up to the plate. So we've appreciated that. We're now starting, as things are opening up, we're now starting to get requests from dental offices and other clinics that want to reopen and don't have enough PPE. And right now we just don't have a lot to offer. We had been looking into a district order through the MAC where we might be able to, if we're as a district potentially ordering a larger amount of PPE, then we might be able to either obtain it for our partners, maybe at cost, instead of us just donating the PPE to all these clinics and whatever who just don't have it because they can't get access to it from their vendors. That is kind of being looked into on that side, the side of the district. So that seems to be not real close to happening, but it's one of those things that we're looking into. We also continue to look into complaints about businesses and parks and people being open or too close together and that kind of thing. Most of those at this point we refer to law enforcement. So we've been thankful to them. They've been we've been able to lean on them for these kind of issues. However, Connie visited a business called Lake Cable Factory. We had reports that they had a number of positive cases. They do have a few positive cases. They weren't Porter County residents, so we didn't know about them. But Connie was able to go over there and tour the facility and see what they're doing to keep people safe and talk to them about their sick policies, and really kind of got a good sense that they were doing what needed to be done to keep their employees safe. And then Letty had the opportunity to visit the state park this weekend. We got calls regarding people relieving themselves in public and not social distancing, and it was beautiful weather, and the facilities weren't open at the state park. So we don't have jurisdiction over the state park, but we went out to visit, and Letty went out and she talked to some people who were monitoring the situation there, who were state park rangers. So hopefully that doesn't bump up our numbers too much in terms of infections in the next couple of weeks, but it was really hard to keep people inside this weekend. That was so nice. Outside of COVID-19, other things happen in the health department still. So I thought it'd be important for you all to know that on April 8th, we had a pod exercise. If you are, I can't remember if you all have been here for one or are familiar with these. So these are, the exercise is for a point of dispensing location where we would set up if a vaccine needed to be administered to everybody in Porter County, or if there were, for instance, an anthrax release or something like that, and we needed to dispense medication to everybody within the county. ramping up and dispensing medication, how would we set that up? So John Peisowitz ran that. That was one of the deliverables for the emergency preparedness grant. All the Porter County Health Department staff was present for that and helped in that. And also some other Porter County offices participated too. So it was a really good exercise. It was, we think about the fact that we are, and we wonder why we're doing exercises in a time of emergency, but this really is, it was helpful to have this done, and it's a little bit different aspect of kind of the state of emergency, and it may come in helpful in the future if we need to deliver vaccines in short order. We also continue, the foods section also is continuing to do plan reviews and review and new openings. They have also had staff from the foods section represent the health department at the EMA office. So we've had somebody there, I think, daily. And that's been helpful too for communication and coordination. And then they've also been working with the event coordinators for the farmers markets. And Sheila, I believe she'll be talking about that in a little bit. Environmental is continuing to do site plans and inspections. They have been quite busy. They have also been helping us field calls and complaints for COVID issues and social distancing issues, which has been really helpful. Nursing continues also. We continue distributing antabuse to the court-ordered antabuse patients. And we have 4 active TB patients, and we make daily contact with them and collect repeat sputums and things along those lines. You know, dogs are still biting; those have to be investigated too. And we're still providing treatment for and testing for STDs and those kind of things. And kind of good news in terms of being in stage 2 and opening things up a little bit, we're planning to resume immunizations later this week. We're starting out in Portage office, and we have been, Connie has been working closely with the pediatricians. They have been keeping track of their patients that they have not been able to immunize because they don't do vaccines for children. I'm sorry, they aren't part of the VFC or Vaccines for Children program. They do lots of vaccines for children at the PEDS office. They just don't do that specific program, which we provide at the health department. So they have been providing us with the patient's names, the ones that need to get seen in sooner than later. And we are working to get them in, those kiddos in and taken care of from that standpoint. So that sums up what I have to report to you this month. I'm happy to answer any questions you may have. Hopefully you were able to hear me through all that.
I guess I have one, Dr. Stamp. This pod exercise, is this going to be the location that this will always be located at, that people will know about in case there is an emergency? Do we have an address or?
Right. No, actually, we have a number of different options for locations for the pod. And it will depend, it depends what we need to do and how many people we need to get through and what kind of time. Okay. So, so we keep MOUs with certain organizations so that we can go use their facilities or whatever. But we also are always kind of looking out to see and evaluate where in Porter County might be good options for things like this. We used our Porter County building this time around. The flow worked okay. We certainly couldn't get 170,000 people through there in any, period of time. It would not have worked for a true emergency and dispensing. But for the purposes of our exercise, it was very effective.
Okay.
Dr. Stamp, Martin Moeller here. I want to follow up on the pod exercises. So assuming that a vaccine does become available, would all the vaccine be distributed through county agencies like the Porter County Health Department in the pods, or would they go to private practitioners? Would they go to our like CVS and Walgreens stores? Looking in your crystal ball, what do you expect to happen?
Right. I can't really answer that question with any degree of certainty at this point. I suspect that it would kind of be sent to all of those they try to get it from all angles. People that don't want to go through a pod, that would rather go to CVS. I think they make that available for everybody. The only real precedent we have is the H1N1 pandemic that kind of was about 10 years ago, and we did some mass vaccinations then. And maybe Connie can answer to how that of course, vaccine wasn't done through pharmacies at that point, but Connie might be able to answer to how that scenario went.
Actually, we did, the health department delivered many thousands of those vaccines, but we also facilitated getting vaccine to long-term care facilities and private doc practices. In fact, Dr. Fleming, I believe your list was, I was looking that up the other day, and we have kept records and of all the private practices that we delivered vaccine to, so they could use it for their patients. And so I'm hoping there's a combination of all of those providers, because then we can get it out faster. The point of a pod is, like Dr. Stamp said, Walgreens, the pharmacists were not giving vaccine then. And usually the pharmacists or pharmacies actually receive vaccine before the health department. Maybe not a lot of doses, but it does seem like they receive it first. But a pod is to get through a lot of people fast. So it's a concentrated effort to really vaccine a lot of people in a short amount of time. So we'll see what our distribution, it always, kind of depends on that, how many doses we can get at one time. Maybe we're able to handle it within our offices. And if we get thousands of doses, maybe we could get set up with a pod. That's why we practice and get it out to providers that will do the vaccine as well, vaccinate their patients. So, but we had back 10 years ago, the health department was the gatekeeper for 40,500 doses of H1N1 vaccine. So we handled a lot. So, but we had a little practice with it, but it has been a day or two ago. So, and things have changed a little bit as well. So with the pharmacies added, so.
Connie, Martin Moeller here. If I can add a little tongue in cheek here, if we have those pods available with a vaccine, do you think our no vaxxers will be at the front of the line or the back of the line?
Front. I'm sure it's always front. Yes.
Sorry about that. Let anyone else have questions for Dr. Stamp before we move on to some of our nurses?
Dr. Stamp, I don't know, have you been having any reports of elective surgeries being requested by the surgeons to have COVID-19 testing performed prior to surgery?
Yeah, I'm not sure how Porter is doing it, setting it up at this point. There are facilities that are requiring that. For instance, LaPorte Hospital, I understand, is requiring all their elective procedures to have a COVID test like 2 to 3 days prior. I don't know that Porter is, I don't know, do we have anyone? Beth, do you have access to those kind of things?
I
Do you know what
haven't
their
been seeing that at
status is?
Porter. I've been seeing it from surrounding counties and the like.
Mhm.
You know, I guess my question is, it's hard enough to get a test ordered on someone unless they meet a lot of criteria. I mean, we get a lot of pushback even from our own hospitals. I just don't know if this is a wise use of resources.
Right. I question that too, especially because, you know, if you don't have symptoms and you're infected, the false negative rate is really high. So I think they're potentially, you know, it's a tool they can use. It's not perfect. It could catch a few patients that they really don't want to do surgery on that might be infected that are asymptomatic. But I agree with you. I think they're trying to cover their bases and, you know, do the best they can to keep it out of the elective arena. And you don't have, if you send your labs to a commercial lab, you don't have those restrictions that the state puts on in terms of guidelines for their lab testing.
Right.
So
It's
I
just
can
hard to
see
find.
if they're running the test themselves, and I thought Porter was actually going to get its own testing equipment. If they're running the test themselves, maybe they can afford to do that.
It's just hard from an office perspective, and I don't know if Patrick has had the same problem, but you know, we don't really have access to anybody to test aside from the people who are using the state lab. So to procure the sample, that's the hard part.
So are you saying you have not been able to obtain the swabs and viral transport media at your clinics?
No, I mean, even to get it to somebody who could do it,
Mm-hmm.
you know, the only person that we have access to is Porter or, you know, the Franciscans, and even they are being quite difficult to get a test run.
Are they? Yeah, we at the health department, we have been working through Alverno, and we have initially we were only able to receive, you know, they said, okay, here you go, you have 5 swabs and 5 tubes. But in the past 2 weeks, we've been able to get quite a bit more viral transport media and swabs. We can do plenty of tests. However, you know, it comes out of our pocket, costs over $100 a test through them, and we don't bill insurance. So that comes out of our budget at the health department. I would think Alverno's been really responsive, actually, in terms of we've been getting test results back very quickly, most of the time within about 36 hours. So if you have your office, maybe talk to them again, because there may be some opportunities there to get people tested that otherwise don't fit the criteria at the hospital.
Okay, thank you.
The update from the hospital as of last week, meaning Thursday, Friday, they did loosen up their criteria, which was helpful in terms of even if you were 65 and older, they then opened up to testing. So the criteria was better, and there was a email I've been looking for that the hospital sent out in terms of, and maybe Derek, you could clarify this. I thought they were either able to procure their own testing and showed the accuracy compared to some of the other options. And I thought it meant that they were going to have their own testing machine. But now in hindsight, with Derek mentioning that, I may have been wrong.
No, Patrick, you're right. The LaPorte actually has that Abbott system with a rapid turnaround, but it's a very select use, and I don't believe they're using it for like outpatient testing.
Yeah, and I know Franciscan had to cut out because they ran out of test medium 2 weeks ago. That's where they were limiting the ability. I sent a patient today to a place called Great Lake testing in Valparaiso off of Frontage Road or something, and they got the results back in a matter of hours. My patient let me know that she was negative in a matter of hours because she takes care of elderly patients as a sort of a personal, private job. And so I, at first, was a little reluctant because I am concerned about, like I mentioned earlier, these serum antibody testing. We still don't have a lot of valid consistency on are these good tests, et cetera, et cetera. What do we do with the results? But that's something I'll look into and let you know perhaps tomorrow, Maria, if that's valid and what that means and how come I didn't know about it. You know, that's the stuff that gets me a little nervous is, you know, patients are finding out more than we should, so to speak. So I'll get back to you on that.
Thank
Yeah,
you.
it's-
Yeah, we're familiar with Great Lakes Labs. They do and have historically done quite a bit of work for the county, like with the, I believe with like, you know, drug testing at the JDC and stuff like that. I don't quote me on that, but I believe they've done some work with that. And we had been in contact with them early on, hoping that they'd be able to help us with some testing, but they had not been up and running yet. So hopefully that's a recent development that they'll be able to take up some of the slack also, especially for close contacts that may be asymptomatic and need to be tested, because everybody else really still, they want symptoms before they test.
Yeah, she had some symptoms enough to validate. It was more or less before she went back to treat others. She was negative. I couldn't believe how quick it was. And reading up on it, it's CLIA certified. They have a relatively clean write-up on the internet. So I'll maybe try to follow up on that tomorrow and let you know. That'll be another nice resource for us to share as things ramp up.
Okay, thank you, Dr. Fleming. Any other questions of Dr. Stamp?
Maria, I'm sorry. At the very beginning, you had mentioned about the over in Valparaiso at the Armory, they're going to start offering free testing. Is this information we can distribute then to our patients or?
Yes, absolutely. You do not need a doctor's order. There is a website where you must register, and they can only test so many a day at every
Okay.
test site. Starting next week, they hope to have a number of test sites up in Lake County also, which would probably include the Gary Armory over by the airport in Gary. So for some people that if you're out of Portage, for some people that actually would be closer than coming all the way down to Valpo to be tested. But those, and then there's one also at the Armory like starting tomorrow in LaPorte County, in LaPorte, the Armory there right as you enter town. So there are some good options there for testing. The website, I believe it's up and running as of yesterday afternoon or today. And I understand you can find it through a link on the ISDH site, but I have not confirmed that yet.
Okay. That's what I was going to ask is where to direct the patients. Okay.
Yeah.
Okay, Elizabeth, why don't I come to you? If you have any questions for Dr. Stamp, or if you'd like to share what's been going on with you professionally.
Well, thanks again for all the updates. I really appreciate you. Dr. Erica Young, she services the health department for the tuberculosis. I know she's been very instrumental in setting those policies for testing at Porter. So she's been a very helpful and knowledgeable person in setting that criteria for testing. So she may be a resource for you guys too if you reach out to her. I know that preservation of PPE continues, but at no point have I ever felt like I didn't have it. I feel like the hospitals have been very protective of their workers, and I'm really thankful for that. I'm thankful to have the work. I have cared for COVID patients, but usually never in the acute phase. It's always in the recovery phase, and some need longer to recover. So, and the hospitals have been just very fluid in their policies and protecting the staff. So I feel really good about that. I mean, that's basically about it. I mean, the hospital setting, it's still a scary place, and it's still, because the visitors can't come and see the patients in the hospital. I think that's been a challenging aspect of it, because a neat thing is they do have an iPad now where they go around and they actually have, they go room to room and allow people to FaceTime with their families. And I think that's nice. They set up appointments for people like that. So they're making provisions.
Thank you, Elizabeth. I don't know if Suzanne, with school being out, if she could turn her mic back on now. She's gotten over her stage fright.
Yeah, as far as, I'm, teaching my nursing classes from home the best I can, but I think teachers are struggling in the community. Parents who have kids at home are certainly seeing that struggle every day too. So we're just doing the best we can. I came back from Florida a few weeks ago, and even though I have a PRN job at a nursing home, at this point I'm choosing not to work. I have 3 type 1 diabetic kids of my own, so I don't feel like that would be a situation where I'd want to risk working part-time at the nursing home and then potentially bringing something home to my kids. So at this point, just teaching from home, and again, appreciate all the work the health department is doing and keeping us updated. And it's really, Dr. Stamp, you really are going above and beyond to keep us updated too with these meetings. So we appreciate that too. So thank you.
Okay, thank you, Suzanne. I don't know that Kathy has jumped back into the world of work, but I'll ask Kathy to share a word with us.
I'm spending my time reading and taking walks, and sorry I'm not in there working, and yet part of me is happy I'm not.
Can appreciate that, Kathy. But Donna's face has stayed on my screen here, and Pleasant Township was the very last township in Porter County to have a COVID positive case. So tell us what's going on down in Couts.
Well, Donna Warner, I checked with Kathy at the medical center, and there were 4 that tested positive this last week. No elderly person. So they were young people, and that's all I know. They were not hospitalized. They were treated with medication. So that's the report I got.
Okay, I guess it's called Pleasant Township for a reason then.
Yes, it is. Yes, it is.
Okay, I think I've touched with all of our board members. I don't know if anyone else has any closing comments on COVID before we move on to Dave's report.
Martin, can I say just one thing about tests? We have been interested at the health department. People are asking us why we're not testing. As Dr. Stamp said, we are not able to get the swabs with the viral medium until about a week and a half ago, get a number of them. But we've also had, we've been looking at the antibody tests that are being offered, and they were sending them out just bunches and bunches, and you've got to figure out which ones are actually worth buying. But we did find a name that we got from, actually presented to the State Department of Health, and did some research on it, and it is the first FDA approved. The company's called Cellex, Cellex Inc. I got a price list, and it's $42.40 per test. And I'm thinking, boy, that's
Wow.
really awesome. However, when you have to buy at a minimum 1,025 tests, and you have to buy them up front, it gets a little pricey. So we're trying to figure out if we can share some of those with someone, and maybe another health department, another agency, but that is an FDA approved, and I understand there's been a few more added to that list, but there are a lot of questionable tests out there, we'll say. So just FYI.
Yeah, I appreciate that, Connie. And I don't, to buy that many tests, even if we came up with the money for that the science on the antibody tests, so even if we get a reliable test, we're not sure how accurate that might be in a couple of months afterwards too. So
I know there are questions, in talking with Pam Pontonis at the state, even the Cellex test, they were questioning the specificity and the sensitivity of that. There are a lot of, you get a cold and it can be caused by a type of coronavirus, and the specificity might not say, oh yes, you had coronavirus, but it could be the cold that you had a month ago and not the particular cold. So that's what we're trying to get appropriately figured out and researched before we would invest money in any of them.
we'll all have to take a wait and see, and we'll have to kind of continue to make it up as we go along here with that. I'd like to move on to Dave's report if we can. So Dave, if you can join us again.
Sure. If Dr. Stamp and Letty and the staff of the health department didn't have enough already on their plate, I want to share briefly with you, and they're both related to the virus, matters that are on the immediate list of things that we have to spend some time and attention with. First of all, pursuant to Governor Holcomb's 5-stage roadmap, we entered stage 2 yesterday. Stage 2 includes a May 11th opening of restaurants. And there are a number of questions and concerns that we're trying to deal with and trying to answer the questions of restaurateurs who are understandably anxious to get back in their business, regarding what they can do and what they can't do, and trying to oversee that in a way that everyone is helped by our input and can better understand their business. We're anticipating that after the openings occur on May 11th, there may be some need for a little increase in the time and the effort we put in by Sheila and her people regarding restaurant oversight. But that's coming up here next week. The second thing that's happening is we are entering the farmers market season. Dr. Stamp alluded to that matter briefly in her report. Again, we've got our first farmers market tomorrow already, and trying to implement and establish and promulgate rules and regulations for the farmers market has been a time-consuming process for Sheila and the other folks that work with her in this area. And I'd like to give Sheila the floor for a couple of minutes and let her kind of explain to you her methodology and where we are and where we need to go in terms of a summer of farmers markets. Sheila?
Okay, hi everyone. So over the past several weeks, we've been working pretty closely with the market masters, and those are the people who coordinate farmers markets. They've all been very cooperative, really seeking out our guidance and trying to develop good safety plans to protect vendors themselves and the public. So last week we provided them with the guidance to all three of the markets. That would be the Valparaiso, the Chesterton, and the Coffee Creek market. And we asked them to submit their final safety plans to us for approval. And basing those off of the guidance that we provide and that the Indiana State Department of Health provided. So some of the things that we asked them to do is to space their booths far enough apart to allow for social distancing, have a layout of their booths to avoid bottlenecks, to allow a clear direction, one direction so that there's no cross mingling of customers. Limit vendors to selling food only, horticulture products and other essential products. Limit the number of customers entering the market. And allowing for staging that prevents the bottlenecks and allows for social distancing. We've asked them not to allow any musical performances, demonstrations, or sampling tables, and to post signage for customers reminding them to wash hands, to use social distancing, stay home if they're sick. We have made it mandatory for all food vendors who have unpackaged foods to wear face masks. And currently, the rule, we've asked them not to allow on-site consumption of food. That could change as the summer goes along and restrictions loosen. We've also suggested that they offer hand sanitizer, hand washing stations, that they try to have each vendor have a separate person for handling food and handling money, and to disinfect the commonly. They've all been overwhelmingly supportive and really just ask us what they can do, how they can make this the best they can. So because farmer markets are usually a social event, we really ask them to limit the actions, remove some of those social event type things like the music. And so far they're doing great. We've already had Valpo submit their plan to us. It looks really good, but their market doesn't start until the beginning of June. The one that starts tomorrow is Coffee Creek. They are also looking really good. And I think I just, while we were on this call, got the final guidance from them. And then on the 16th, Chesterton does start also. Chesterton, I don't know if any of you have been involved in that one or gone to that one. It's a very large market, and they have really pared down their vendors to about 7 to 10 vendors. So they're all really taking great measures. And then Dave reminded us earlier today that we are not the enforcers of the governor's order, but we certainly will be observers. We will take pictures and take notes of any time we see possible concerning issues, and then forward those on to the proper agencies to handle it. So you guys have any questions for me?
Well, Sheila, as we look further into the summer past July the 4th, if we stay on target with the phases that the governor has presented, we're looking at the large events later in the summer. And at this point, we could anticipate that those will go forward. Is that correct?
Correct. And I'm expecting a lot more guidance to come out as we get closer to those. You know, as everybody keeps saying, these are unprecedented times. And so we'll just kind of take the punches as they keep coming and roll with it. And luckily, for the most part, everybody is wanting to do their part to keep everybody safe. So I don't anticipate too many problems. You do have your few outliers who kind of want to push the rules and the system a little bit. But like they said earlier, the police sheriff's department have been working really closely with us. And I got to say, Couts even this week, the chief there delivered the executive order to all the restaurants in Couts. So I thought that was terrific. A great way for us all to work together to accomplish the same task.
And I think it was Dr. Fleming said 80% of the people were wanting to follow the rules. If we have 20% that aren't, that's a big percentage.
I think that's reflective of human nature.
Yeah.
Yeah.
So we'll wait and see how many problems those 20% can cause for the 80% of the good guys.
You know, I'm optimistic.
Okay. Sheila, are you willing to yield the remainder of your time back to Dave?
Oh, of course.
Okay.
I just have one comment in closure on both of those issues, both the farmer's market and the restaurant. Sometimes we forget that there are two components to this. It's one thing to say you can open up or you can have your farmer's market. The question is, if you open up, is anybody going to come? And I think that's on the minds, especially of the restaurant people, that they're going to really have to, and their motivation to do everything right and have it sanitized and everything and to publicize that is to raise the confidence level of prospective customers so they will come back. And I think that's going to be problematic for some of these restaurants. End of my report.
Okay, thank you so much, Dave. We are going to go back to some of our normal business. Chris sent out all of the claims and receipts from the month of March. You've had a chance to review those. We will entertain a motion to accept the claims and receipts as presented for approval.
I'll make a motion. We accept the claims and receipts.
Okay, we have a motion by Elizabeth and a second by
Kathy.
Second by Kathy. Anyone have any questions or concerns about those claims and receipts? All in favor designate by saying aye.
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 All opposed? Motion carries. We have approved the claims and receipts. Would like to go to the staff members. We just heard from Sheila, and I don't know if Dan or one of the sanitarians or Letty wants to report for sanitarians, anything at all, briefly?
Well, I talked to Dan earlier, and pretty much everything's still going the same. In reference to that 49 landfill,
Yes.
we still don't have the results. We're hoping to have them maybe by the end of this week, if not next week, so that then we can know what we need to do, if anything. But other than that, they've been very busy with plan reviews. The new inspector has been working out very well. He's very energetic and doing a great job, learning really fast. And other than that, they're still working as if COVID wasn't even around.
And yeah, it was surprising to see. Of course, the reports we have are about a month behind in seeing. So we're getting the March reports, which we didn't get the shutdown until the middle of the month. But even with that, it's surprising the amount of items that are continued to go on. And Dave had mentioned that also. So with all the restaurant plan approvals and such, it's like, wow, things are moving forward despite the virus.
Wow.
So, okay, do I have someone else want to jump in here? No? Okay. Connie, do you have anything briefly that you'd like to say on nursing's behalf that's unrelated to the virus?
Gosh, there's something else. No, I would like to thank Dr. Stamp has been here about every day, helping us and guiding us, and we're lucky to have her.
Okay, thank you, Connie. And Chris, you may want to beef up the vital records. If things at my office are any indication of what's going to come across your desk, they're going to be busy.
Yeah.
So anything else you'd like to add from vital records?
No, I think the only thing that we've noticed within the last few weeks, they started adding COVID-19. So we'll be adding that in for the April reports. Noted.
Okay, I guess we shouldn't be surprised at that. And then we will come back to Dr. Stamp for any final words she might like to give us.
I think I've probably talked enough. I can't say enough though about the staff. The staff has been great. They've worked really hard and on the daily stuff and the COVID issues, and we're bringing in. We've been trying to give people breaks and work on, with half staff as best we can to kind of have space in the office, but we bring the nurses in, all the nurses on Monday. And I've been pretty thankful that they've been able to keep up with their caseloads without having to have all the nurses there every day. So they've been doing a really great job.
Okay, thank you, Doctor. And then I'll come back to our board members. If any of our board members have comments, questions, or concerns for the good of the cause this evening.
I'd just like to again say I appreciate all the updates, especially the daily updates from Letty. I try to remind patients and my staff of the 176 that are better, et cetera, things like that. The updates, trying to keep people motivated and calm. And so I appreciate you guys have such a great attitude. It motivates me as well. So I just appreciate that very much.
I'm sorry. I do have a question. Somebody just texted me and asked if I would ask you, how is this going to work with the election coming up?
We're all going to vote for Dave.
I agree. I agree. Dave is good.
That sounds
Are
good.
are we voting at Dave's house? Or
Yeah, we don't know how it's.
There are signs all over, and I think we're anticipating that we've heard they're going to have early voting down the hall in room 102A. And I think it seems like voters is really ramping up to have that start, and I'm not sure what day that will be, but if it's next week or this week, but I believe that that's what they are planning. So yeah, with mask, everybody.
Yeah,
And they're really encouraging mail-in voting as well.
Yeah, that's what I read.
But you'll be
We've
able to
already
vote on
voted.
June 2nd as well. So,
okay.
although I think they're going to have many fewer polling places.
Yeah.
Okay.
And whoever's asking the question of you, Don, I think we go back to the farmer's market where we're not tasked with enforcing this, but we do have the option of observing this. So however the Board of Elections chooses to go forward with it, we won't have to be the policing agency of how that happens.
Okay.
So
Thank you.
if we have no other business, we will entertain a motion to adjourn.
Motion to adjourn.
That
I'll
sounded
second.
like Dr. Fleming, and a second by Donna Warner. All in favor of adjourning our meeting this evening, designate by saying aye.
Aye.
All opposed? Meeting adjourned. You may give any final comments off the record at this time.